Good afternoon all. I am Dr.sowparnika, Consultant Reproductive Medicine at Milann Fertility Center, Sarjapur branch. The topic for today is Vaginal Microbiota and Infertility. Why this topic? A very important question. There is a lot of talk which is going around the world about this microbiota. If I quote a few, Sadhguru, who is speaking about save soil, what does that mean? That is enriching the soil with a normal microbiome. And secondly, many of the gastroenterologists, they are just telling us the gut health is all about a balance between a normal and abnormal bacteria. The same, that is the vaginal health, is also about a balance between a good bacteria and a bad bacteria. That's why the topic for today, vaginal microbiota and infertility. To know about what happens normally, we should first know about where these bacteria are there. The normal bacteria are lying on one in the vagina and also in the uterus and also in the fallopian tubes. We are mainly speaking about this vaginal microbiota. What is this vaginal microbiota? If at all we look at the epithelium which is lining the vagina, that is the stratified squamous epithelium. What is this stratified squamous epithelium is? The cells are layered in multiple layers inside the vagina, and the estrogen hormone which is secreted in the body after the female starts menstruating causes this stratification. And once the stratification happens, these cells are filled with what is called as the glycogen or the sugar material. Once the progesterone is secreted in the later phase of the menstrual cycle, the lactobacilli which are there inside the vagina will convert this glucose or the glycogen into lactic acid, making the vaginal pH to be acidic, that is less than 4. And this acidic pH will not allow the bad bacteria to thrive inside the vagina, and hence it is the good bacteria which just pushes out the bad bacteria. Unlike the gut microbiomes, the vaginal microbiomes changes as the life of a woman goes on. That is premenarchal, even before starting the menstruation, the microbiomes are different, and during the menstruation also, first half the dominance of the microbiome is different and the second half is different. After that, during the pregnancy it is different, post-pregnancy it is different, and after the menopause the entire bacterial line changes. Why does this happen? That is because the hormones in the body which will predominantly control the microbiomes which are present in the vagina. So coming to that, what are all the types of microbiome which are all seen in the vagina? One, we will divide it into two. One is the lactobacilli predominant and second is the non-lactobacilli. The lactobacilli is divided into 4 groups, out of which many of them which will predominate the vagina is depend upon the hormones, and the non-lactobacilli predominant usually causes the disease. So, what is the relationship of this with the infertility? Of late, I am getting many patients who are like 1 or 2 IVFs fail, and even when I am doing the transfers also, the embryo is looking good and the endometrium is looking good. Why is it the pregnancy not happening? That is what is making us study the microenvironment which is present at the spot of implantation. When we go in deep, and the studies also give evidence telling that the lactobacilli predominant vaginal atmosphere usually gives us increased chances of implantation and also increased clinical pregnancy rates, and also it decreases the abortion rates which happens within 3 months. So why am I telling you this? 2 take-home points are there. You might have seen a colorful ads which come in the TV, which tells us about the antiseptic lotion which we use to douche the vagina. What does it do? Yeah, definitely it will kill the bad bacteria, but also it will kill the good bacteria also. That will actually hamper the microenvironment. So what I would tell you is, don't use any kind of antiseptic lotions, and it should be only water and a clean water which you will use to douche your vagina. And secondly, when we are looking at a IVF success rate, we usually add many tablets. You might be wondering, what are these? So usually one of those is the normal bacteria which we add, which is dominant in the lactobacilli, which will help you in creating the microenvironment, which will support the implantation, and also it will help in increasing the clinical pregnancy rates. When we look at many multiple infertility problems like endometriosis or bacterial vaginosis, where we see many other bacteria are predominating the vaginal flora, like Gardnerella, and also other things like streptococci and staphylococci, which will inhibit the normal lactobacilli and cause vaginal infection, which will decrease the success rate of a normal pregnancy, IUI pregnancy, and also IVF pregnancies. So a request from my side, instead of taking a much of antibiotics to treat, add on the normal vaginal microbiota, just like how you take curds or a normal sporolac tablet during your gut infection. Thank you.